I am still,
Looks like it's letting me record.
Okay.
I'm still floundering around a little bit, trying to get things working in 11.
You understand? It is being recorded because I got the pop-up.
Let me change my name here. I'm going to change my name. Participants, me, rename.
Oh, you can rename on the fly. I'll be darned. I didn't know that.
Yeah, you got to go to the three dots.
Uh-huh.
And let me bring up my email. So I'm ready to receive email from you.
Yeah, just hang on a minute.
She's in a new OS and she's still adapting.
Oh, I can totally sympathize. I had a colleague of mine with his laptop asked me to transfer some files to his computer. And I said, oh, I can help you with that.
Yeah.
No, I can't help you with that. It's like he was
Right.
on 11 and it was like nothing was, not nothing, but there were things are different.
Okay, now I have my mail program up and
Yeah. It's a shame when you have to be bilingual to speak OSs in the same from the same place, you know.
Now
Windows.
I have a window up here, David. It says host is currently host. Reclaiming host may disrupt breakout rooms, polls, and screen share.
Go ahead and reclaim host and see what that does.
Okay.
Oh, okay. I think I am host. I don't know what's going on. I'm getting weird dots here. Let me see. No, I'm
That's
not.
strange because that's not what our
No,
computers
I'm
are
not. I
saying.
just oh, okay. Now I'm seeing the dots. I can see dots for other people.
I think what's happening is that I'm recording on the internet, Stan.
Well, I think I'm recording now. I have a red dot. I have a target logo up here on the top of my screen, and I have pause and stop buttons at the bottom, which means that I'm recording.
Does it say that it's recording or does it say the recording is paused?
Mine says recording with a dot 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 and a flashing red.
There's a
Yeah.
recording icon with a pause and a stop button next to it.
Huh,
It might be recording twice, right?
that's
Pull out in.
possible.
Mm-hmm.
Well, that can't hurt. But
Well,
what I specifically want to do is get it to my computer so I can use it for editing.
right.
just a minute.
Assuming you have room in your computer I assume you do.
This
Carole,
is,
take your time. We've got almost a half hour, so don't worry about it.
yeah, no,
Yeah.
I'm just,
Don't panic.
I'm trying to do an attachment and it won't let me.
Keep
So,
keep
just,
calm and carry on.
Can you paste it into the
that's what I'm
chat?
going to try to do now. Yes. Um,
I really need to buy a Windows 11 and see if an old dog can learn new tricks. But
oh,
after 7, which I was happy and I knew it and I could get around in it.
I
And
was happy with 7. Yeah.
yeah,
7 worked for me.
711 for work groups.
7 worked for me.
But
8 was a disaster because that's when touchscreen
Oh,
came.
we had 8 at work and they were unusable. We had to throw them in the trash, you know. they had to go around and buy used computers because
Stan,
none of the software
Yes.
would run in 8.
can you give me your email address?
Stan, Stan, B as in Bravo, 3 as the number 3, and D as the letter D, Delta. StanB3D@gmail.com.
Right.
No.
Okay.
I'll send you some Post-it notes. You can do like my brother does, hang them on Post-it notes. Well, we won't talk about weather. You guys are going to have like a high wind chill of -3 tomorrow or something insane. That Polar Bear Express just ain't going away.
Well,
Yeah, we always shrug that off and say you're in Minneapolis, you're in Minnesota. What do you?
Yeah, it's a source of pride to me. What do you mean? I don't want a wind chill above 0. Come on, man.
I think it was Prince who was famous for saying it keeps all the criminals out of Minneapolis.
Well, we'll talk to someone about that in the Ethiopian or Somalis or wherever you guys are supposed to hate up there. Why somebody would come from the Horn of Africa and move to Minnesota, I don't know.
Probably corrupt government like we've got here.
Yeah, and you can argue about criminality. The major crimes have been selling knockoff Gucci bags and Rolexes. That is a crime. It's hardly a dangerous felony, but
Yeah, it's economics is an interesting topic, but it's hard for me to wrap my brain around. Gives me a headache
yeah,
because it seems like as soon as you find that there's some kind of a level of agreement or something that you can do about it, then they throw a bunch of whole new vocabulary at it, makes it,
yeah,
they shift paradigms. It's like there's no there there.
yeah.
Uh,
But
you know,
selling gray market or whatever
yeah,
on the street,
besides,
you could call that a street hustle, right? Which is somebody trying to make a buck. And we're supposed to admire that, you know. Uh, there's Auk.
hello all. Hello,
Hello, all. Hello, AA. Which is higher than the bond rating for the state of California, I think.
So Carole, what's it saying? What's it doing with you?
well, now I can't find let me fuss with this, okay? Now
Okay.
I can't get Notepad up.
Oh, now it says Tom is host, but that's his name, I guess.
Stan is host.
Okay. Stan Bissinger host, and your name is host on my screen.
Tom, I'm
Oh.
recording. I'm recording, I
That's
think.
that I do not want to. My name is host because
Right, we know.
my previous use of Zoom, I was the host.
Yep.
A different meeting yesterday.
I got you.
And so now it persistently says my name is host.
Right.
And I will rename.
Okay, you know how to do that too.
Wait a minute. I do not. I don't want to rename Stan.
You won't. Go to participants and
Okay.
click next to
Yeah.
your line.
Yeah, I saw the thing and it said me and it's a host and I clicked on rename and it said I'm going to rename Stan. Never mind, it's just um it's just Zoom.
Yeah.
Well, talk to Carol about trying to get an email out with Windows 11. She's in a conundrum with that. She's having a, she's trying to email me her list of videos.
Okay. Just if you guys would leave me alone for a little bit, I am going to make this work.
Yay.
Yay, Carol.
Don't quit
Why
using my name because it's an interrupt vector for me.
Yep.
Okay.
And you know,
why did
I can't keep doing what I'm doing if I keep hearing my name.
I renamed myself and now it still says I'm the host.
No, well, you might be the host, but it says H-Town, and mine
Yeah.
says Joe Schmo.
Oh. We appear to have two hosts. We can survive that.
Host in name only, I guess.
We
Yep.
weren't sure we might have three with David too. Yeah, I don't think I'm the host because I have a leave. I don't have an end, I have a leave. Who has
Yeah,
it?
whoever has the red X stop in their up lower right is the host, period.
No, it typically says leave, and then when you click that, you have the option to transfer host if you are the
Right.
host.
Right. Or
I
you
do
can
not
add
have that option.
Okay, yeah. No, and it looks slightly different. But
No, when I'm the host, I have a stop sign button and I click on that
correct.
and I can transfer the host. But I just have a leave, but I just have a leave door right now.
Okay.
If you click
Looking
that
at
leave door, it will say leave meeting or transfer host.
If you are host.
If the rest of us click that leave door, it just says leave meeting.
Yeah, all I get is leave meeting.
Oh, really? Oh,
You're not the host.
What do you have? Do you have an end? Do you have an end button?
David and Stan have red buttons. I do not.
How can you see what buttons they have?
And they're participants, I imagine.
Oh.
Yeah, David and I are both recording.
All right. Well, your screen name is HTOM, and under participants it says parentheses host. So
Host,
you are
yes.
the host. Now Stan Bissinger, just his screen name is Stan Bissinger host. That doesn't make him the host.
Oh, no. But
I know. You don't want to be the host?
I can be the host.
Do you have an end and wait, what is your leave indicator? Is it end or leave?
It's a red X, and then you click it, and you can leave, or you can end the meeting, or you can transfer host.
I'm going to.
I'm starting to learn Zoom, for better or for worse.
Okay, I have host tools.
Down in the lower right-hand corner, what does it say? End or leave?
Audio, video. Invite, mute. Okay, looking at the participants list, I have on the bottom, invite, mute all, and more.
Well, mute
That's
all. There's
called-
a hint. You're the host. Yeah.
No,
That's
that's
good.
not what I'm talking about. I'm talking about
Okay.
on the main screen where it
On the
says
main screen.
chat, participants, react, share, AI,
All the way on the lower right.
Oh, on the bottom.
all the
Lower
way
right.
to the right.
You
Participants
have a
chat.
red door or you have a red stop sign.
I have a stop sign,
You're the
red
host.
hex stop sign.
You're the host. You're the host.
host.
Period.
Sorry, Stan, didn't mean to do that.
Well, as long as I'm recording to my computer, I don't care.
Right.
How did?
Well,
Oh,
I don't
I
own.
think the thing I was doing yesterday, I was the host. And since I came here, no, I didn't. Did I come here through? I thought I came here through Meetup, but no, I'm not
I
sure.
did. I came in through a meetup, but that's kind of irrelevant.
That's irrelevant. I think as long as you've
Yeah.
got the right invite code.
All right.
Yeah, I think Zoom remembers that last night I was the host,
Yep.
different meeting, and so when I said I want to join this one, well, why did it make me host? It means because it remembered I was host last night for a different meeting? That makes no sense. Of course, it's Zoom.
This
It
this
doesn't-
yeah, Zoom is mysterious, that's for sure.
It makes assumptions.
Oh. Good morning, gentlemen and lady.
Hmm.
Oh.
All right. So
Carol, do you want to try dropping them into the chat?
Nope, I've just got it into the mail now.
Okay. Well, you certainly haven't warmed me up to getting 11, that's for sure.
no. All right. Now supposedly I'm connected. No, I'm not. Reckon Bluetooth. Oh, well, I got to turn the power on.
I saw
Uh,
BBC last night with Brian Cox. I don't know if any of you like Brian Cox or you know who I'm talking about.
Yes.
He's more or
Yes.
less he's a degree. He's got his doctoral degree. He used to work at CERN, but he's more of a communicator. You know, he's a handsome kid and he looks, you know, he does good videos. But they did a really good video. I can find it and post it on the Royal Institute, the scientific method. I mean, it starts out talking about Newton and his, and it was kind of it occurred to me that what they're doing with that program is advertising Britain as being a good place to be if you're trying to figure out where to live and carry out a scientific career. In other words, if you find yourself not liking what you're doing or having to do somewhere in the United States, you're welcome to go to Britain.
yeah, it's a farm club. It's a farm club for the research industry.
Here, I'll find it and I'll put it up in the chat. But it's well produced and it's going to be a series.
Okay, Stan,
I got it, Carol. Thank you.
take a look at it and see if it makes sense.
No, it's fine. What I do is I select it and drop it into a Word file.
Yep.
Yeah, well, each of these is labeled with the name of it
Perfect.
after No, you know what I mean. After the,
URL.
there we go, yes.
Perfect, I got it.
Oh,
Okay.
So now you can relax.
God.
In other news, I discovered that Intel has abandoned its Unix distribution,
Really? I might
which
have heard about that. Wow.
is called Clear Linux. And the big thing about it was that it was really CPU optimized.
For Intel, yeah.
For Intel or AMD 64-bit CPUs.
Nice.
There are, in the compilation process, it makes, I think there are 5 user configurable directions it can take. But towards the end, it got so smart, those were being removed because it was looking at the machine you were running on. It asked, are you compiling for this machine? And then it took away all the options and just gave you the speed route.
Optimized for your hardware. Yeah.
Optimized for your CPU. And it worked fine on AMDs too.
Yep.
And it's gone. And just suddenly, poof,
Yep.
which
Bean
I
counters.
missed that. Were you talking about Unix or Xenix?
Unix. I'm sorry, the Linux.
Linux. I'm sorry.
Clear
Yeah.
Linux. What was I doing?
Vanished just like UCare health programs.
Oh God. We have a consultant for that who tells us which things to take. Looks at my ongoing medical problems and Marty's ongoing medical problems and our drugs and whatever, and comes up with recommendations for us. Choose this one or this one or this one. And so far, he's always been right. It's gotten to the point that I just go and sit through the hour-long presentation of what this would do and this would do and that would do. And I just say, the recommended one, please.
Huh.
Yeah, it sounds like UCare dropped over 100,000 people.
Yeah,
Yeah,
I'm currently on UCare.
me too.
I was looking at Health Partners, but they got bought out by some Tennessee company or something. So I'll probably end up with Medica.
Yeah, and you realize these companies you're naming are all regional. No idea what you're talking about.
Yeah. Dan, you're
We were
muted.
with Humana and they backed out of Minnesota.
Yeah, Humana I've heard of. Yeah, good and bad.
Yep.
Tom, can't you get in with the VA? That's where I'm at.
I could. I haven't really looked into that.
I remember that when I was with Cigna, when I was teaching at ITT Tech, I missed the window. In other words, I was too busy and I didn't realize that I had this window to re-up my insurance. And I went to the drugstore to buy my $8 medications. It was 120. And they said, you better go talk to your provider. And not only had I missed the window, but I wouldn't be eligible to get back in again for another year. So
And there isn't There is another option. I have Kaiser Permanente, but I also have the VA.
Well, the
And
VA,
I have to
Kaiser-
let Kaiser know, do you have another health provider? I go, yeah, I've got the VA. Are you using them for this condition? No. But I might if you guys do me wrong.
what happened is I had about 5 or 6 co-instructors at ITT Tech that were vets, and they said you should go through the steps, and there are some steps involved. But I haven't seen the bills for my medical for ever since then, and it's I
And you can
definitely
go
think
wherever
that,
you want.
huh?
You can
Well,
go wherever you want, and do you have to go to VA hospital or what?
Well, I go to, yeah, I have VA as my provider, yeah.
Well,
But
that wasn't my question. Where do you go for your care?
VA to Memorial One or wherever it is, the Veterans Hospital.
Okay, do you like the care you get there?
I love it. It's well, maybe it's because I mean I was with okay, let me give you, I had my psychiatric care at the what's the one on Excelsior and 100, not Methodist, but
Port Nicollet?
Abbott
Park Nicollet.
Park Nicollet. And when I went to the VA for my psychiatric care, my doctor was Dr. Charles Dean, who was teaching psychiatry at the University of Minnesota at the time. So I was very impressed. And I just had my shoulder replaced about in May of last year. I mean, I just can't say enough about how great that VA is. Plus, it's 22 blocks from my house. It's a lot shorter drive for me to go to the VA than it is to go to Park Nicollet.
And mine is 22 miles.
Well, I
Yeah.
get that. It's not always as convenient, but
Do you live down in Bloomington or something?
I live in South Minneapolis. I'm 5401 Elliott. I'm right between Diamond Lake and Nokomis.
The thing that's got me on that, I could get it too, but it's like trying to figure out what you do for your wife. I don't think they have a plan that lets her in on that.
Nope.
Right. Well,
They will let you get buried
Yeah.
together. That's good.
Yeah.
the only thing that I don't get to the VA is dental. And I have a plan, dental plan that's reasonably priced reasonably. But anyway, I posted the Newton, that video, that BBC video is describing to the chat if anybody wants to check into it. It's well produced. Talks a lot about the scientific method and what, it's basic stuff, but and the fact that the Royal Institute has a library where everybody publishes and all of their scientific work. They stressed the importance of Cavendish and why he was critical, because he was good at writing down all of his processes that he did, discovering the things that he discovered.
Okay, guys, I've got 10 o'clock here.
I do too.
Okay.
I have
So,
958.
I have 958 technically.
958.
Except on my thermometer it says 955, but what does it know?
okay, now I'm going to try to share.
Uh-oh. That's a different tutorial, Carol.
I just see I see a video by Dr. Ben Miles, who's reliable, I think, on scientists just discovered how to starve cancer.
All right, we see part of your screen, Carol, the top half.
Now, wait a minute.
Drug frontiers, yeah.
Okay.
But
Now-
it's all
There you go.
yeah, right.
Can you see it?
Yep.
Yep.
Hallelujah.
We'll,
Oh,
we'll see when we get to your small font, yeah.
um, well, I usually find if I make it any bigger,
Oh, that's good for me.
Yeah, no,
Just-
it's, oh, that's beautiful,
Like, yeah,
beautiful.
that's fine.
if I make it any bigger, it covers up stuff I need to do.
Yeah, there's the whole thing
Don't
about going full
leave it.
screen, but keep your slides, they're handy on the side.
If you have a mouse with a scroller, you can just use that. You don't need to look at the slides.
Right. No, it's not that I feel that I need, I'm scrolling through it, but
Right.
I if I make it very big,
Carol, just leave it be.
There, beautiful, don't touch it.
You just want to sit and look at that for,
No, because I'm zooming it for
No.
myself.
come on.
Please
No,
continue.
I'm zooming it, yeah, my own self.
Okay.
Yeah, I don't want to cover up the do things bar.
That's
Right.
fine.
Okay,
That's fine.
now this is going to be, we are starting out with biologics because biologics are the new thing in drugs. And the distinguishing character, well, yeah, the distinguishing characteristic of biologics is that they are not made by shoving some chemicals together. These are drugs that are produced by manipulating living organisms into producing the proteins that you're looking for. And this is an unbelievably complicated, complex, and expensive process. But it produces drugs that will do things that no others will. So the picture on this side is, can you see my pointer?
Yes.
Yes.
Okay. Well, in the corner here, we have aspirin. And that is, just a chemical pharmaceutical, the old-fashioned kind. And compared to that, pretty much the smallest of the biologics that is in use is human insulin. And look how much bigger and more complicated a molecule that is than the aspirin. And all these little bumpy things are folded proteins. They are not individual atoms. They are, all the little bumps are folded proteins. And by the time you get up to a monoclonal antibody, that's big. And so one of the problems with biologics is you can't take a pill because these things are fragile and they will not survive your digestive system intact to actually eventually get into your bloodstream. So for some of the smaller biologics, like the insulin and a few others, they can be taken by subcutaneous injection. But the good stuff, the newest and most complicated of the biologics, which are mostly monoclonal antibodies, have to be taken by infusion, which means, they stick a big needle into a vein and you sit around usually you end up, going to a hospital or clinic. Some doctors have infusion setups in their offices, but few and far between. So in order to get the drug, you got to sit for an hour in the clinic and have it dripping into your vein.
Question, what are the numbers at the bottom of the graph?
That's essentially, those are essentially weight numbers. In other words, how much does an aspirin weigh, as opposed to, and by that I mean, 1 molecule of salicylic acid or acetyl salicylic acid. What this says is that a molecule or you can't say molecule, a clump of human insulin, a unit of human insulin weighs in this ratio to a molecule of aspirin drug. And, so those are essentially weight numbers.
But the scale of the proteins on this chart are accurate to each other.
Yes.
Hmm.
I mean, and it's just an example, some monoclonal antibodies are bigger than other monoclonal antibodies. And so, well, anyway, so the problem with these drugs is that they're fragile. You cannot take them as pills because the digestive system kills them before they get anywhere near your bloodstream. And they break down outside of a very narrow temperature range. These things have to be stored, before they hang them up and put them into your veins. They have to be stored in a refrigerator or freezer that will keep them from 0 to 8 degrees centigrade. And
Well, that's not
that gets to be a problem in shipping them places. One of my videos will get more into that, but it's called the cold chain. And you somehow have to ship this drug out to the people who are going to be giving it to patients, and it has to stay at that temperature, and they have to store it at that temperature. And so just really incredibly more complicated, more fragile, more difficult to make and deal with.
But dry ice will fix that.
What was that?
Dry ice, you can throw it in UPS with enough dry ice and insulation.
That would be too cold.
Yeah.
Well, I mean, you'd have to, yeah, no, right. There's a range. I got you. Yep.
I mean, they mail them in refrigerator controlled packages.
Right.
And all of this difficulty and complexity and fragility is one of the reasons that these things are so costly. And believe me, the biologics are costly. Now, Stan,
Okay.
I've never heard of this before, Carol. Is it possible that Demis Habitus's AlphaFold has brought this particular research into play?
no. Although AlphaFold is helping it along a lot, but they were making, well, for instance, the Biologic Entevio, the one that treats
I've heard of it.
irritable bowel syndrome
Yep.
and
Mhm.
Crohn's disease, the one that keeps people from having to have pieces of their intestines chopped out
Yep.
surgically. That
Mhm.
drug has been around for many years before AlphaFold was on the horizon. So they were making biologics before AlphaFold came along, but now it's helping to make even more complex ones, if that makes any sense.
Yeah, I have two quick questions, Carol. So I see the root word clonal in there.
Yes.
Should I read that? In
You
other
should
words,
read it
are
as
these
clone.
are not gene editing tools, and these are just drugs that interact wherever they're supposed to interact, right? They're not editing your genes and etc. Correct?
Whoops. What the hell?
So that was a yes or a no.
Was my computer is doing things I don't understand things.
Yeah. Um,
I think you cut and pasted something into your screen.
Yep.
I think you took something from another screen and by accidentally copied it to your
yes, I know, but I ought to be able to get rid of it.
Control Z. Control Z. Up or undo. Edit, undo. Control Z works.
Now,
Yay.
now, okay. Some biologics, the more complex biologics, involve gene editing,
Aha.
but not all of them.
All right. Got it.
And
What would you say is the beginning? What year or what time frame was biologics? When did it start?
well, human insulin was the very first of the biologics. And I believe that came like in the 70s or the 80s.
Okay. So it's been around.
But they're going to tell you a lot of this in the video that I'm going to get Stan to play for you.
Now?
Yep.
Oh, okay.
And I always put the URLs for the videos in my presentation so that you know, it's not dependent on a separate piece of paper. People
Right, but I can't type that fast and I can't copy paste it, so.
Well,
You can.
so do I have to get out of this before you can,
Yeah,
I have
you
to
have-
stop sharing, right?
right.
Okay. So you just want to, yeah.
I think we're ready.
Well, I'm seeing the video, but it's not going anywhere.
Right. Looks like Stan stopped it.
Is there a problem with playing this, Stan?
Okay.
When I see a drug ad, Carol, do I know that it's a biologic? Do they say biologics in the drug ad, or?
Probably not.
In the fine print, they say it.
Oh, okay.
And in your Entivia, which is advertised probably, I see Entivia ads probably 30, 40 times a day on mainstream. They've been around for quite a while. Yep. And
Yes.
I think I've heard the term biologic in their ads.
Ah, okay.
Yep.
Well, interestingly enough, all of the Entivio in the world is made in a facility in Brooklyn Park.
Hmm.
This is the big selling drug for a company, an international company called Takeda. Their home office is in Japan. Strictly speaking, they're a Japanese company.
Yep.
But they have hundreds of facilities in the US, hundreds of facilities across Europe, and other countries.
And they're not made in China, right? Or are they?
Um,
We don't know. Doesn't
well,
really matter.
I don't know if Takeda has facilities in China or not. I really don't.
Hey, Stan, you're the first one who commented who has his hand up. Go ahead.
This reminds me, this is off topic a little bit, of beer and the yeast that's involved with beer. I know that Pilsner Urquell, which is a very highly, people love Pilsner Urquell. Even when I was in Germany, they would describe the Czech beer as being superior. They said it was the yeast goes back 800 years. So I don't know if that's just maybe an interesting metaphor. It's probably a different size molecule or a protein or whatever. What is
Trust-
yeast?
Yeah,
Dean knows about Czech beer. Yeah, and you're right.
yeast is not a biologic. That's as much as I could tell you there.
It's a living thing.
Yeah.
Okay.
You might train a yeast to make them, but that would be different.
Yes, and now I suppose it might be possible to use uh, a collection of yeast cells as your biologic base to produce these proteins, but again,
So on the scale chart, yeast would be huge compared to the biologics.
no, small.
Oh,
The,
I think it might be more of a building block for a biologic.
okay.
I
Most,
don't know.
we're going to get into something called CHO in later videos. CHO stands for Chinese hamster ovaries.
Hmm.
And I'm trying,
well,
I'm trying to get this where I can see who's got their hand up.
No one does right now.
No one.
Well, but I would like to okay, what do I ask for in view to get you guys just a little down the side?
Click participants at the bottom of your screen.
Um, um,
Nope.
I think you
no,
want multi-speaker.
Tom, she's talking about the gallery style view,
Yeah,
not the participants.
Upper right-hand corner view, and then there's a little grid.
Yeah.
Looks like a Rubik's Cube.
It does.
yeah.
Well, I guess I can't get
Okay,
that, you
there's,
know.
Well, don't worry, I could
If
call
you-
on people for you if
Okay.
that's your problem.
So Tom, would you be willing to call on people when they have their hand up? Because
Sure. Yeah,
I just I can't manage both, especially with the
yeah, it's hard for the presenter
with
when
it this big.
you're sharing.
Okay. Now I am about to give you another video, which is an overview of the manufacturing process that this will give you a slight impression of how difficult it is to manufacture these things. But we'll get into some of the complexities later. So,
I've got it up. Do you want me to play it? I've got the video up, Carol.
yeah,
Is it the second video on your list?
Journey of a Biologic Drug to Market is the one I want you to play. And let's see, I gotta unshare.
I don't think you're
You're
sharing.
not sharing now.
Oh,
So don't worry about it.
okay.
In 1928, a young man shuffled onto a stage. Imagine being able.
Sorry.
Okay, Dean has his hand up.
Yeah, mind-boggling. And I know some of this, and I've seen some of this. I've seen the big tanks and all that. The thing is, for me here, is if you find something that will pay off that $1 billion worth of decades long, then you'll see and TVO ads on 60 Minutes.
Yep.
But if you're looking, if you're going after the rare ones, are we going to spend 100 million, 200 million per patient with the rare diseases? But no, I get it. The greater good. And no, this is really, really good stuff, Carole. Thank you.
Well,
Mhm.
I'm glad you're enjoying it because it gets more complicated from here.
I'm glad I don't need any of this so far.
Well, no, well, actually, now, wait a minute. Let me go back to sharing.
So why is it that the Chinese are the only one that have the hamsters? Why can that be done by anybody else?
Because Chinese hamsters are superior. He said
Well, as a
facetiously.
matter of fact, there are no hamsters involved. Well, okay, let me get this up. I've got to,
No hamsters were harmed
yes. Originally, one Chinese hamster was killed and the ovaries harvested.
you don't have to kill a hamster to get ovaries, but go ahead.
This is how they did it.
Well, they don't bother to spay the hamster and
The hamster doesn't have civil rights, yeah.
yeah. Okay, one hamster was killed, but beyond that, it turns out that the Chinese hamster ovaries cells are particularly good at being cultured, meaning you can grow the cells all by themselves in a medium. And we're about to get into talking about that. But only one hamster was killed, although at least 70% of all the biological drugs currently being produced in the world use the medium of Chinese hamster ovary cells.
We should build a statue to that hamster.
What?
We should build a statue to that hamster who gave his life, her life.
Yes, if you're talking ovaries, pretty much it's a her. Now I'm trying to find, I've probably covered it up now. I have to be able to share it out. Ah, there we are. Okay. Okay. Now we're going to talk a little bit about the whole medium, and it talks about why this particular cell culture has come to be the best cell culture for biologic drugs. And there are many, many reasons why these are so good. And we'll get into most of them. Okay, I suppose we should do one more.
I've got it ready.
Oh, good. So let me unshare. Yeah, now this is an actual picture through a microscope of some Chinese hamster ovary cells. And I believe they are actually floating in solution. So, uh, okay. Now,
This is very fascinating. It's all new to me.
Hmm.
I'm blown away.
Yes.
say that again.
I am blown away.
I find this to be very fascinating and I did not know about it.
Enlightening. Yep.
Okay, well,
I'm more
it gets
interested,
better and more complex.
I'm more interested in the implication there in the ad that Brilliant is now including biology courses. If so, I may subscribe.
Yes.
Yep.
This happens to be the only one of the videos that I picked that came from Brilliant, but they do have uh, a lot of biology stuff.
Well, that's good. Thank you for that info.
I've been
All right.
following, I've been
Thus
following
the name.
SciShow for years now. Hank Green has been doing it and they've been doing, I think they are very good videos.
Yep.
SciShow.
I knew they had a lot of good STEM on hard, physical sciences and math, but I
Yeah.
wanted something that also has
And
immunology.
they speak English that Dean's 80-year-old ears can actually and brain
And
can
then
process it.
Hank has a brother by the name of John Green who does other programs like Crash Course. And there's a pair of brothers and they have a blog as brothers that they just talk to each other. It's really good.
Okay, let's continue so we can get into the future of these biologics.
Okay. Now I actually got interested in the biologics and where they were going because for the last like 5 years, no, 4 years, I think, my son has worked for Takeda in the labs. He's doing stuff with the CHO cells in the laboratories.
So there's some nepotism going on here.
My son, not my nephew.
Well, yeah. Never mind.
Sorry, but I had to be
No,
nasty.
Dean said facetiously.
Besides, well, actually, the original nepotism was mostly sons rather than nephews.
Yeah.
But okay, I just put a little bit of a little bit more of some of the stuff that he was telling you. And now, am I sharing at this point?
No,
No. All right.
No.
Let me see if I can find where I share. Ah,
Ta-da!
okay. Now this is to some extent a slightly tell you a little bit more about what that show video was talking about. And they were playing a little bit fast and loose there. The cute hamsters that they kept showing you were actually Syrian hamsters, which are the ones that are usually sold as pets in the US. And they're much prettier than the Chinese the Chinese hamsters, the wild Chinese hamsters. But anyway, I don't know. Do you want me to read this to you, or can you
No,
all go ahead and read it? Some of the interesting things are that the CHO cells are one of the few cell lines that
Yeah.
grow suspended in liquid. Many of the cell lines of other things grow on a surface in a petri dish, and the surface is what they're eating, what the cell is taking in to grow and divide. And it's just much easier to scale up to commercial quantities if your cells are just suspended in a liquid that has the food they're eating, as opposed to having to be grown on a flat surface. And what else? Yeah, they are putting out sugars that are very compatible with human sugars. And, just this gives you a lot of the why everybody's using CHO cells. Now, this video said 2/3 of the biologics are being made in CHO cells. And according to my son, it's more like 90% now.
Oh.
That 90% of the biologics that are being created as drugs are grown in the Chinese hamster ovary cells, just because they have so many advantages. And most particularly the fact that you can float them in a bioreactor that has, gallons and gallons and gallons of material. Okay. Now I'm just giving you a little bit of background. And this is how I first got interested in the biologics, was that 4 years ago, my son got this job. And, I end up talking to him with some frequency. He comes over and, we have lunch once a week, but, just, he'll give me a call after work one day and tell me about all the disasters they had, and, how they almost lost a batch, and what's going right and what's going wrong. And so I have just become very interested in, what's going on with all of these biologics. And the two that are being produced in the Takeda facility in the Twin Cities, which is up in Brooklyn Park, are Entyvio and a drug called Adcertris. And Adcertris is the newest thing in cancer treatments. And specifically, it is a cure for both Hodgkin's and non-Hodgkin's lymphoma, which is a blood cancer. And let's see. The interesting thing about Entyvio is that it's quite a well-established drug. And right now it is absolutely the best thing you can take. There are several other drugs, biologic drugs, from other companies that treat irritable bowel syndrome or oh, come on, Crohn's disease.
Yeah.
But Entyvio pretty much outshines them. You know, it is currently the best thing you can do. And according to Mike, all the Entyvio that anybody's taking in the world that you see constantly advertised on TV is made in this plant in Brooklyn Park. Nobody else is, that's where they make it for the whole world. And this particular plant is currently taking in about 70% of Takeda's revenues. In other words, all of the drugs they're making in other plants are 30% of their revenues. And Entyvio here in the Twin Cities is 70% of their current revenues. Now, this is, of course, going to tone down eventually. I don't know how long their patent lasts, but and the Adsertris, which is treating the blood cancer, the Hodgkin's and non-Hodgkin's lymphomas, is absolutely the newest thing, the most cutting edge thing in cancer treatments, because they have managed to come up with a protein. And by the way, I mean, they make the Entyvio on the CHO cells. They make the Adsertris on CHOs, everybody is starting with CHO cells. That's just the factory. And then depending on what you feed it and the temperatures you use and the pressures and the acidity and the you get them to create different proteins. And the adcertrus protein is such that it will seek out and bind to only the cancer cells. And then they have added to that the fact that now that they've got something that will bind only to the cancer cells, they have wrapped up a chemotherapy drug inside the protein. And so essentially, this is a way of targeting targeting the chemo only to the individual cells that are cancerous. It will not bother a cell right next door. And so, you know, this will go after, you know, stage 4, totally metastasized all through the body. And it is revolutionizing this type of drug. As soon as somebody, you know, comes up with another one for a different type of cancer, but this type of drug is just revolutionizing cancer treatment because it can target only the cancer cells. But so Mike has been telling me for about the last year now that Takeda wants to farm out the adcertrus product, which is becoming more and more in use. You know, doctors are buying this up. For their patients in increasing numbers. And so Takeda is looking at, or has been looking at, finding another drug company who will license the production of adcertrus from Takeda, and then they can go on at this facility to put in another experimental drug that has just passed all of the requirements, and they want to make that here. Well, it turns out that the first company that they tried to do this with, and I actually don't remember the name of that company, they haven't been able to replicate what Takeda is doing here in the Brooklyn Park. And they have been at it for over a year. And what was that?
So the Takeda team is out there in the field trying to get them up and going with this process, and they can't get it figured out?
Exactly.
Wow.
And they have given this company all of their specs at every stage of the game. And they have managed to okay, there's a lot of steps in this. You start out with a vial of CHO cells in liquid, and you put it into a 250 milliliter beaker. And you start them growing. And it's gradually it's taking up the nutrients, and under the right circumstances and the right acidity and everything, for these cells to start turning out the right protein. And you literally start with a 250 cc beaker, 250 milliliters, and you are agitating that for several days. And then you move on to, a beaker that's a couple of liters. And no, I think at that stage you move on to a heavy plastic bag that's a couple of liters. And again, part of what you have to do to get this to produce the right protein is that this plastic bag has to be wave agitated by a machine that it's attached to for several days. And it goes on and on and on, scaling up every time until you finally get into one of these bioreactors that, holds many, many, many gallons of liquid. And it's, again, you have additives and agitation and, stirring and everything. And you keep sampling it until the concentration of the protein gets to the point where, that's as much as it can produce. The cells are going to start dying off. And so when you get to max production, then you go over to trying to extract the protein and get rid of the live and dead CHO cells and everything else. And you're just extracting the protein that's the drug. But this other company, despite the fact that they have all of the specs, has been unable to get all the way through the, they're sampling at every stage what this ought to look like. And they'll get, 3/4 of the way through, and something goes wrong. And they've been trying to do this for over a year. And this was going to be the most incredible amount of money for the company that they're farming it out to. They would pay a licensing fee to Takeda, but, they would be getting, but they can't do it. They absolutely cannot. And while Takeda at other facilities has managed to actually get the drug produced in small batches. But Takeda itself in these other facilities, facilities of theirs, have not managed to get it to the final stage of, commercial batches. And so they're going crazy over this. And
So we have a few questions now.
yeah, but I mean, this is just an example of how incredibly complex and picky some of these drugs are. Okay, Tom, why don't you just call on people in order?
Okay, I'm first.
Good.
So to me, from what you've been saying, it kind of looks like the future of biologics is bleak because the manufacturing process is so precise and difficult and hard to replicate. Plus the years-long testing and approval process makes them very expensive. Although it guarantees that they're, well, doesn't guarantee, but it would suggest that they're safe. So I don't know. Is there really a future for biologics? It's a very complicated way of doing things. But maybe it's the only way we have of producing certain kinds of drugs at this time.
Well, okay, there are hundreds of biologics out there that are working, Yes, they are difficult and complex to make, but they've got the process down and it's working. I mean, they
Not
are
everyone can get it
selling.
down, apparently.
What?
Not everyone can get the process down, apparently.
Well, no, what I'm suggesting is this particular drug is the most complex that anybody has ever made.
Well, is it the biggest molecule or the biggest?
Well, I'm not sure it's the biggest, but the fact that they have produced the protein that will specifically target only the cancerous cells and then manage to wrap that protein around a chemotherapy drug so that it goes in, it attaches to the cancerous cell, and all of a sudden the chemotherapy has been delivered literally to an individual cell. And that is, at this point in time, the most complex, the most tricky biologic anybody has ever made. And they thought it was great. I mean, they had a company, a facility that was turning it out in commercial batches. And it has become incredibly popular because it is in many cases curing people, and in many other, it has increased the 5-year survival rate for people whose lymphoma has metastasized. Stage 4 is right before you die. It's increased those people's survival rate who start treatment after it's already metastasized to, it's added 5 years. So it's really worth doing. And they got one facility that can produce it. But this is just an example of, some of these things are right up against the edge. And well, anyway, maybe you want to ask
Okay,
get the
Stan,
rest
you're
of the
next.
questions.
Stan,
I've been looking at their website. Approximately how many team members does Mike work with out there at Takeda?
Well, okay. Each of these drugs has for each of the stages, there are teams, there are 4 teams that work on each stage of each drug.
Right.
And Mike is on the growth team. And then after him comes the purification team and, that type of thing. And, but they are working 12-hour days. And they're working 12-hour days, 15 days out of the month.
It says here the site has expanded from 42 full-time employees to over 400, making Takeda the largest biologics manufacturer in the state of Minnesota. They've got 32 acres, 92 clean rooms, 2 laboratories, a warehouse with ambient cold and freezer storage, utilities production, and office space.
Yes, and
Now, do you think they can just grow there and continue doing the cancer scale up there, or do they have to take it to another location?
well, they are at this point in time, they have increased production at that facility of the cancer drug. And they're trying to decide whether to start again with licensing it to another company or try to bring it up in one of their other facilities. I mean, they've got a couple of plants in Massachusetts and, all over here.
I believe what you said 15 minutes ago is that they're trying to make room for production of another
Yes,
drug in the plant. So they want to move this one out to the
right.
different place.
But given that they can't move this out as they had planned, they have increased production here, and they're dithering around trying to decide because they really, really don't want to have only one facility making this drug. They want it to be.
Well, because of the trail getting it to the user, technically you have to have this manufacturing somewhere close to every large population, I would think.
Why?
Because it's such a fragile chain, the last from the supply from the factory to the end user is fragile.
2 to 8 degrees Celsius is a very narrow window.
Yes,
Not really.
but my
It's
understanding is that it is
general
shipped
refrigerator
in,
temperature. It's
uh,
between 34 and 44 degrees Fahrenheit.
it is shipped in, not in dry ice or anything like that. It's shipped in little vials. And they are shipped in controlled refrigerated boxes that are keeping that temperature. And when they reach a facility, a hospital or what's between a doctor's office and a hospital?
Clinic,
A lab,
clinic.
They are carefully transferred,
Oh, man.
into a refrigeration facility at the clinic or the hospital. And I mean, they've worked this out, but again, it's very expensive to, not be able, you can't ship it UPS. And well, anyway,
Eric's next.
Has Mike mentioned any benefits accruing from being able to directly compute the shapes and charge distributions of any protein now, or conversely, from being able to take a cancer cell antigen and compute from that a protein that would sort of complement it or attach to it or disable it?
I'm not quite sure what you're asking. Back up and start again.
Okay, it's now possible because of DeepMind's work to just start with any amino acid sequence of any protein, which is routine to determine, and compute the shapes of three-dimensional shapes and charge distribution of that protein. And I think, I don't know if it had done it yet, to go the other direction and start with the cancer cell antigen protein and compute a sort of complementary antibody protein that would attach to it or disrupt it, that antigen.
He has not talked about that. And I didn't see anything about it in my research. But I believe that the AlphaFold or whatever it's up to was used in working on the Adcertris
Mhm.
because you have to get the chemotherapy drug there and get the protein to fold around it.
Mhm.
So I believe that was one of the things that made this possible.
Okay.
Okay, H. Tom.
This is a fascinating puzzle. I'm stuck on the idea you can't do it. You can't do the same thing over there. I really want to say they should hire a process engineer who doesn't know what they're doing and have him tour both places and both processes, because it must be that someone is doing or not doing something
Yep.
that the other place.
It,
Where is the other place?
I do not know.
Oh,
I mean,
it could be something in the atmosphere
yes.
that
I mean, I would guess that
um,
what is happening is that their complete specs for how to make this drug are not really complete.
Yeah,
There is something
they're
that
they're
there are,
doing something that they don't know they're doing.
yes, exactly.
Can I interject? I don't have, I'm on a cell phone. I don't see anything.
Okay.
Can I just interject a real important
Mhm.
point? This is an art form. This is an art form, just like beer
Mhm.
making, whiskey making.
Yep.
It's difficult. There are people involved, and it's an art form. They do things differently. It's not something you can necessarily write down. So just keep that in mind. I mean, that's why these things aren't simple.
Well, I mean, okay, you do not want to take this impossibility. You can only make it in one place as a characteristic of all biologics. This is the first time they've run into this,
Mhm.
you know?
Well, not really, because
If you,
every beer maker learns how to do it in a specific way, and
yeah,
every little thing they do differently is affects the process. It's
yeah,
not stuff that you can write down. You might try writing it down, but he hesitates pouring something in, whereas another guy dumps it in all at the same time.
Yeah.
It's very complex, and where you have people involved, it just adds to that complexity.
Well, I did have another couple of videos that I would like to show you.
Please.
Are we,
yeah.
Well, we still have
Can we
several
knock off the
hands.
3 hands real quickly?
Yeah, can we do Dean? He's been waiting.
I've been patiently waiting, not impatiently. Yeah, this is a classic example where, scientists, pure scientists, are the Chinese hamster ovary. Then there's engineering involved. And then, as someone just pointed out, there is the artistry of the manufacturing, and all of those apply.
well, and actually another couple of videos that I wanted to show you are talking about their clean room procedures and their how incredibly complex their testing and sampling procedures are.
Stop
And
sharing, Carol. Stop sharing. I'll get this going.
okay, wait a minute.
Yeah.
Come on.
Meanwhile, while he's starting that, Eric, you have a
Yeah,
last
I just
question.
wanted to mention likewise, like I don't know, was it who else is talking, Eric or the other Eric, or anyway, that from a couple of years experience doing biochemistry and being around it and reading a lot about it, even at just the most minute amount of a substance, say in the present or absent from the water or the nutrient broth or anything, could just throw everything off. Just minute things that might be very difficult to measure or detect.
Hey, Dean.
I'm the only one that has my hand up. All right. Yeah, so I took notes real quick. GFP, green fluorescent protein. Next comment, bacteria are our friends and enemies, and viruses are not. And this all reminds me of how difficult / expensive this stuff is. Billionaire medicine. Unless you have a billion potential patients, and then it's economically viable. But yeah, no, great stuff for thought. I wish we had 30 minutes for discussion. I'll defer to the next hand that I don't see.
Hey, summary, Carol.
Hmm?
Summary. Future something.
Well, actually, there's The next time I have a 2 months from now.
I would like a part deux of this, Carol.
What?
wants
Part
a part
deux,
two.
that's French, part two.
Ah, okay.
And you could have the first week in January if you'd like it and continue from here.
No, because that's going to be on it's going to be concentrating on cures, things that they have, biologics that they have made that have cured diseases that had no cure before.
But you realize, Carol, that you fed us a lot of food for thought here.
Oh,
and
yes.
discussion. Okay, good.
But I mean, this is just a really big area.
Oh, yeah.
But I thought, you could get a feel for how complex this is, where you've literally got instructions for getting dressed. Okay, sit down
I
and
got a
bend
good feel for it. Yep.
and
I
put your
appreciate that.
good foot on this side and your bad foot on this side. And
Mhm.
here you're touching the inside of the garment, but here you're touching the outside of the
Mhm.
I mean,
And then start over because you did it wrong.
Yeah.
Well-
And I'm not Nostradamus, apparently. Had I known what I know today, I would have gone into bioengineering in a heartbeat. It's
Uh-huh.
fascinating. Bioengineering. That's a huge, huge field today.
You're talking about, Carol.
Yeah, yeah. And I said, well, once I knew Mendelssohn and his peas, and I knew how brown-eyed and blue-eyed worked, I was done with biology. I never took another biology class again. I had to in college, but I took a oceanography class that
Okay.
qualified as a biology. But yeah,
The last biology class I took was 9th grade.
wow.
That was before Watson and Crick came
You
up.
didn't have to take one in college? I had to.
What?
I had to take a quote biology class at San Diego State University, not South Dakota State University. And
My
it was an
undergraduate
oceanography
was
class
math,
that
physics, and
included
chemistry.
whales. Yeah. No, I just figured I needed everything I needed to know about biology I ever knew. Well, that was a mistake.
Yeah.
Yeah.
Well, my 10th grade biology teacher, where I learned more than in any course until graduate school, by the way, but he did not believe in evolution. Stereotypical
Oh my God, that must have been
sergeant
great.
in the Marine Corps Reserves, assistant football coach. He just went through phylum 1,
There you
protozoa,
go.
phylum 2, porifera.
Yep.
And he taunted us. And he broke 3 blackboards making his point. And he treated us like Marine Corps recruits.
Wait. When you say blackboards, they were black when you and I
Yes,
were
white
kids.
chalk and right over.
Absolutely black.
And he
Yeah.
broke 3 over the years, making points. And he treated us like Marine Corps reserve recruits.
I love him.
Terrified of him.
Well,
Mitch, Tom,
Civilian
do you-
blackboards are different than Marine Corps boot camp blackboards.
Wow.
Marine Corps boot camp, they're made out of 3/4 inch plywood.
For good reason,
Yeah.
I assume.
That's right. With a little black paint on them or something.
Yep. Bang, bang, bang. It's happy.
Mitch, Tom, do you want to tell us a little bit about what you're going to do next week?
I sent you a.
I posted it.
Oh, okay. It's the future of blood, inspired by a recent
Future of
donation
what?
I
I'm
gave.
sorry, I missed that. Future of
Blood.
blood, BLOOD.
Yeah. Poke yourself in the arm, blood comes
Yeah.
out. Okay,
I'm a
well, that's not good.
15-gallon donor.
Yeah, congratulations. I'm I think I've got 10 now. Um,
How old do they let you donate now? Because
there's somebody in Italy who's still donating at 104.
oh, great. Well, maybe I'll
All
resume.
right, yeah,
David, didn't-
I cheated. I did mine by donating platelets, which took me an hour and a half, but I got 5x the credits. So every whatever of platelets, I got 5 pints of blood. So that's how I got.
I'm O negative.
How
I'm O negative, and they just want the raw stuff for
Oh, negative.
emergency
Yeah, they do.
use.
They don't want my blood. Oh, pause.
Yeah, they rejected me quite a while back because I was
they
taking
do.
methamphetamines, but I'm
No,
off that now.
no, it's
They
Legally.
O
want my
positive is
platelets more.
they want all of.
They
'Cause-
want all the above.
There's
By the
the
way,
thing is there isn't enough being donated. Period.
yes,
And
yes.
so what are we going to do about this?
Well, join the
And
Marine
that's
Corps.
tune
I
in
did
next Saturday, and you will discover the future of blood. We
Yes.
are making,
I am awaiting that.
manufacturing blood,
Yep. And
and
thanks to
it's
the
good
Marine
for
Corps,
you.
thanks to the Marine Corps, Boot Camp 1965, MCRD San Diego, which is why I live here now.
Mhm.
And we would get, we were working a 7-day week because 13-week boot camp was down to 8 weeks because of Vietnam. You might have heard about it.
Mm-hmm.
And so we would get Sunday afternoons off if we would go down and donate blood. Plus, we got a trip to a Padre game and would be honored